Hello and welcome to CNBC-TV18. I'm Shereen Bhan. Every year, cancer kills at least 10 lakh Indians. This year, India could record at least 20 lakh cancer incidences. However, the real number could be 2 or 3 times higher, according to a study by EY and FICCI. In fact, late-stage detection is the true killer, and the lack of awareness and screening continue to cause deaths which could otherwise be prevented. First, let's address the ignorance. Only 1 out of 2 Indians are concerned about cancer. It's no surprise that nearly 30% of adults continue to consume tobacco, which causes 1 of 3 cancers in India. Obesity and alcohol consumption are the other major causes of cancer. Now, India only screens 5% of its population for cancers, which is negligible when compared with its global peers. When developed countries have 3 PET CT scanners per million people, India does not have even 1. In cancer care, India does poorly, with only 2% of the population having access to palliative care compared to 14% globally. Now, what's worse, most of these comprehensive cancer centers are located in metro cities. Our healthcare system needs twice the number of oncologists that it currently has, and the same goes for radiotherapy centers. As we tackle the issue of ignorance and early detection, we also need to make curing cancer affordable. It's nearly 3 times the cost of treatment for other diseases. At present, cancer-related hospitalization is out of reach for 80% of India's population. Economically speaking, the potential productive life lost to cancer could result in a GDP loss of nearly 40 billion annually by the end of this decade. To discuss how India can address the rise in cancer cases, I'm joined by Raj Gore, the chair of FICCI's Task Force on Cancer Care. He's also the CEO of Healthcare Global Enterprises. Also on the show, Gautam Khanna, chair of FICCI's Health Services Committee. He's also the CEO of the Hinduja Hospital. And Srimayee Chakraborty, Healthcare Services Partner at EY India. Thanks very much, Gautam, Raj and Srimayee, for joining us here on this important issue that we take up on ION India. Srimayee, let me start by asking you, the numbers don't paint a picture that we should feel any reason for optimism or hope at this point in time. In fact, the reported numbers perhaps, don't give us the real scale and scope of the problem that we are trying to address. And I would imagine that the pandemic has only worsened things. Srimayee, explain to us how bad the situation currently is in the country when we talk about cancer.
So as you are aware, and you have highlighted that, Shereen, is that the cancer disease burden is expanding in the country, and the cumulative risk of developing cancer of any organ is 1 in 6 to 1 in 12 among the urban population of the country. The cancer disease burden is estimated to be 19 to 20 lakhs, and the real incidence could be 1.5 to 3 times higher because of the lack of reporting which is happening in the country. And what we are also seeing is a very severe late-stage detection, which is due to the poor penetration of screening programs, as well as the lack of awareness. Now, while these are the issues from the demand side, if we have to characterize the supply side of the situation, there is lack of penetration of comprehensive and affordable cancer care in the country. And we have only about 30% of the districts in the country having an access to a single comprehensive cancer center. And about 60% of our radiation equipments are located in urban areas, whereas our rural population is concentrated in the rest of the country. Now, as a result of all of this, what we are not being able to do as a country is to provide the right treatment at the right time to the last mile of the population. And it's manifesting in the form of poor outcomes. And we do see that the mortality to incidence ratio in the country is perhaps the highest across all diseases. And that is in comparison with other nations like the US, the UK, and the China.
Yeah, so that is the problem that we are currently faced with. But let's address the supply side challenge that you spoke of, Srimayee. And let me get Raj and Gautam to comment on that. Raj, let me start by talking to you about that issue. You know, Srimayee gave out a whole host of numbers that give us the telling story in terms of the access deficit at this point in time. Now, what can be done to bridge that deficit, both by the government as well as the private sector? How do you make cancer care more accessible, more affordable in this country? Because for 80% of the population, it is clearly out of reach today.
Yeah, so thank you, Shereen, for that question. I think if you see what's happening in healthcare recently, government has assumed a role of primary and preventive care provider and also become a largest payer. Almost half the population is covered by various government schemes. and private sector has taken a role of tertiary and quaternary care provider. I think private sector is already playing a major transformative role in providing cancer care in India by bringing the best or most advanced cancer treatment options in India. Today, 70 to 75% of comprehensive cancer care center in India are owned either by private or by trust. At HCG, two-thirds of our 21 cancer care centers are in tier 2, tier 3, even tier 4 towns. And we've been able to do it by, driving higher equipment utilization, higher talent productivity, higher consumption efficiency, and provide affordable, comprehensive treatment to needy patients in tier 2, tier 3 towns while balancing the needs of our other stakeholders.
Okay, so you're saying that you've been able to take your cancer care centers to tier 2, tier 3, and in fact tier 4 cities as well. But you're probably the exception, Raj, and not the norm at this point in time. So let me get Gautam Khanna of the PD Hinduja Hospital into the conversation. Gautam, many thanks for joining us. As Raj pointed out, it is largely the private sector that is being able to provide good quality treatment when we talk about cancer, but it is not accessible to a large population of this country. Now, how do we ensure that it can be made affordable? How do we ensure that it can reach out to larger pockets of this country in need?
So thank you, Shereen. And so let me just compliment you firstly for hosting this important topic. And like Raj mentioned, so there is an issue of access to the rest of the population, and private players are doing whatever they can. There is a lot of important role which the government can play in this. And if you will permit me, I think one of the most important things, if we categorize the government's suggestions to be implemented, should be in notification, prevention, and then detection. So for example, now if cancer has become a notifiable disease, and if it is a notifiable disease and there will be a national cancer registry for this will help us to know, they have the information about the incidence and the type of cancers which affect the Indians, which help in real-time data collection, counseling, treatment guidelines, and also will help supportive care. And if you look at the prevention side, where I think one of the main things is, firstly, that vaccination really helps in prevention in many cases, and we have seen that HPV vaccination for all girls, if it's mandatory, can really reduce the risk of cervical cancer. So we need to encourage such R&D of such vaccines. The other issue which you rightly pointed out is 1/3 of the cases are due to tobacco. Now, if that is the issue, what we need is enforcement of anti-tobacco, anti-gutka legislation, banning the surrogate advertisements, and disincentivizing tobacco consumption. So prevention and notification helps. And then the last thing I would say is the massive screening. We know that the private sector cannot meet the challenge of governments of India's cancer burden. But if we have massive screening drives and also teach self-screening to the population of the country, a lot of it, and maybe ASHA workers can get involved, we catch it at the early level. Associated with this, if we do more training of people, we will be able to address and prevent a large case of cancers in the country. So unless we prevent and detect in time and do screening, it will be very difficult for us to manage the cancer burden in the country. Over to you, Sri. Thank you.
Yes, the cancer burden is an enormous burden that the country is dealing with, and it doesn't get spoken about, but there is a huge socio-economic impact on account of this massive burden that the country is faced with. It impacts families, it impacts individuals. But Srimayee, let me come back again to address the supply side issue and the supply side challenge that we were talking about. And, again, as I point out, Raj is giving us examples of what they're being able to do at HCG. Gautam is giving us examples of what they've been able to do at Hinduja. But we're talking about scale and the need to be able to provide accessible, affordable care care at scale. And there is only so much that the private sector can do. So what are the interventions at this point in time that you believe are necessary? Are there any global examples that we can look at where things have worked that can be perhaps playbooks for India to follow as well?
Right. So, Shereen, while India is definitely unique with respect to its own set of challenges, the geographic expanse, the kind of resource availability which we have in the country. However, if we look at some specific measures which can clearly be taken even before we get to global learnings, is that if we look at a lot of our medical and government colleges, both private as well as government medical colleges which are there in the country, a lot of them still today don't mandate oncology as a part of their program. So if all of them were to actually take up oncology as a part of their program and start providing that care to patients, then possibly we could double up on the availability of treatment options to more and more population of the country. At the same time, if they would also take up investments on radiation, I think that would create a significant amount of demand, which would attract more investment by medical technology companies to set up maybe production as well as assembly lines in the country.